Hello, I want to be absolutely empathetic to this topic because I know that we can easily not talk about birth trauma and the problem doesn't go away, but I want to shed light on birth trauma and the effects it has on children as they walk through life. And not only the children, but the families as well. And I'm going to first start with a story. And it's not really a story, it's actually an experience that I've had a number of years ago when I saw baby Addison in my office. This mother had been through many pediatricians, called up other chiropractors. I didn't know where to turn, and baby Addison was 4 years old, and the mother was told, start preparing and filing arrangements for her funeral, in essence. And this baby would just sit there and shake and shake and shake, and her head was up and shake and just wail. As soon as I walked in the room, mom was the only person that could hold her, wouldn't let dad hold her, and no one could touch her neck because she just screamed. Most likely because the last time she had an issue was when she was born, and she was really forcefully pulled by her head from the mother's womb, and the APGAR score is like a 4. And if you understand APGAR scores, a 10 is like perfect, and you want to be like a 9 or a 10. And this baby was a 4 when she was first born, and went up to a 6 at 5 minutes later. So in a bad shape and a bad way to go. And I share this with you because I know that other children have gone through the same thing. And so where do we drop the ball with birth trauma? Where do we drop the ball, and what are we going to do about it? And that's what I'd like to discuss in this video and help you understand why a chiropractor is talking about birth trauma, because it is a very applicable to what I do as a pediatric chiropractor. Maybe we're going to look at it and shed some light on this and give you some insight, because you might have an experience with some issues with birth trauma with your own child, or maybe know somebody as well. So let's dive in. So first of all, what is birth trauma? Well, birth trauma can be as simple as a misshapen head when born. It can seem like a seemingly normal birth, but the problems can show up, 2 weeks later, which often occur with colic, with reflux, failure to latch. Those are some issues as well. Or they can be very severe where baby's just holding their head and not even able to hold their head up, and they're not responsive at all, like baby Addison was. So it can range in a certain range of symptoms that show up, which symptoms are the sign of the body not working, and we're going to look at that a different way as well at the end of this when you want to give this talk. So what affects birth trauma? I got a list here and some notes. Position of the baby definitely affects birth trauma. Hey, if the baby is breech, that can affect birth trauma, but in other countries, they'll deliver breech babies, no problems at all. I had other people from another country, I saw like my baby was born breech. They do it all the time. But if the baby is anterior, meaning that they're facing up when they were born, that usually elicits a lot of back labor on the mom's part as well. Or interuterine constraint can cause a problem where the baby's not able to move effectively, usually due to the position of the hips. High level of medical intervention, not only during pregnancy, but especially at labor and delivery. If the baby's large, maybe harder to push out, lengthy or long or short, painful delivery. Hey, I've seen babies that just push out, and they're not getting the reflexes, that constriction of the body's body and the head to kind of elicit some reflexes in that breath reflex as well. And then usually a smaller shaped pelvis by the female as well. That happens too. Now, why is this go undetected? Well, usually the handoff is, hey, my OB or midwife or whoever delivered the baby, but we don't see the signs of it later on because now they go to a pediatrician. So really, there's no continuity of care between who's delivering the child and who's taking care of the child later on. So your pediatrician should be asking about what was pregnancy like, even conception, what was conception like, what was the APGAR score of your child's birth is very important question for your pediatrician to ask as well. They should be diving deep into this because we see that research definitely heavily favors a strong, healthy birth. And if there's a birth process that's complicated by all kinds of these other indicating factors that I just mentioned, it sets the stage up for that baby not to thrive during life. So how can you see this, or how do you know this? Well, first of all, look at the APGAR score. Always get a printout of that as well. When you leave the hospital, have this on hand. That should go in the file, baby's health file right away. Get a happy of that. But it often affects what we call the vagus nerve. And the vagus nerve is nerves that come underneath the skull, right by the first bone in the neck, and travels down. This one will travel down to this far. This one goes all the way down to the stomach. It affects the gut. It affects the spleen, the liver, the heart, even the voice, a bit of swallowing, taste. All this because of the vagus nerve, and that can be compromised. Now, when this nerve becomes compromised, it's what we chiropractors will call a subluxation. There's nerve interference. And then specific about this vagus nerve, which I'm going to go into more detail in a later video, so keep watching the videos and keep following this series. It's also motor to the visceral, the gut, the lungs, the heart, your voice, the swallowing, all those types of things, but it's also sensory too. It tells the body and digestion what to do. It also has to indicate what's happening with the body so it can respond accordingly too. And this nerve is very often affected in birth, okay? In fact, a mentor of mine, Dr. Tony Ebel, started looking at a pattern, and he's seen these kids that were having problems, and he started asking these questions about birth, and he found that 85% of these kids that were having issues with colic, reflux, neurodevelopmental delays, autism, ADHD, 85% of those kids had a difficult birth or a combination of pregnancy or complications after birth or during birth, those types of things as well. Difficult latch, nursing, breastfeeding, sleep disturbances, disorder, reflux, colic, digestive issues, torticollis, which really starts to indicate ear infections later on. That's very, very heavily favored. Plagiocephaly, that's a misshaped head. Shoulder dystocia. Often, sometimes broken collarbones can happen as a result of a birth issue as well. Cerebral palsy, because there's lack of oxygen to the brain, will start to happen. Seizures. It's an electrical storm in the brain where, hey, things aren't meshing up the way it is. Autism, sensory processing disorders, it really starts telling the brain this vagal nerve tone will start to shut down, and it's like the brakes. But what happens is the nervous system's caught in a state of fight or flight, and it won't calm down. Speech problems, motor issues, social or emotional bonding. They're not making eye contact as well. Ear infections related to the torticollis that I had before, and croup or chronic immune type of disorders as well will all be signs of a potential birth problems coming from birth. So what are we going to do about this? How do we course correct? You know, a pediatrician is going to look at those things and say, how do we turn off the symptoms? Well, I'm not going to look at the symptoms. I look at the symptoms as saying they're what we trace back to the nervous system. They're not the problem. They're a result of a problem of a nervous system that's not working effectively, that's not allowing your child's body to function and work the way it's programmed and designed. So we're not going to isolate individual parts of the body. Hey, if the child has RSV or asthma, which I've seen cases like this in children from birth, we're not going to say, hey, the lungs are the problem. We're going to ask a deeper question. What's causing the lungs not to work correctly? And when we start to understand that the nervous system is the system that controls and coordinates all the functions of the body, even the cells and tissues of the body, we're going to start diving deeper and actually measuring that as well, which I got to do in that office. So how do we go to look at? So when a specialist, a pediatric specialist, is going to look at different parts of the body that aren't working correctly, what I'm going to do as a pediatric chiropractor is link all those different parts of the body and say, hey, what's not working correctly? Hey, if the light in your room, and the TV in the room, and that speaker in the room are all hooked on the same circuit, well, that gives me clues to say, hey, the nervous system's not working correctly, and this is the nerve we need to work at that's compromised, we have to start understanding how do we get that to work correctly. Most likely the upper neck is the case. Even in C-section births, we wouldn't hold our child. We don't go around 5 minutes after the child's born and pick them up by the head. I always use Uncle Gary as this example. Uncle Gary comes in, says, "What a beautiful baby," picks the child up by the head. You know, if the dad's in the room, Uncle Gary's getting face punched. He's getting drug out of the room. You do not do that to a child. But in a C-section birth, that's exactly what happens. Now, I'm not in the room when that happens. I don't know what happens, but it does happen. And so we have to understand that there's are definite problems as a result of birth that can show up not all the way at the exact time of birth, but it can be very latent. 2 weeks later, 4 weeks later, 4 months later, when the baby's not hitting those milestones. And mom has a clue. Mom usually can tell by 6 months, something is not right with my child. And that's how we need to do. So what are we going to do? Okay. To get the help that we need? Well, MDs aren't really trained to ask these questions. They're more like, hey, what do we need to do for medication? They're understanding the chemical aspects. What do we do to isolate this part of the body and then say, how do we get that body to turn off and work the symptoms to turn off? Whereas I'm a chiropractor, I'm going to look at tracing that spine back or follow those problems back. And we have to do some detective work. That's why we're asking histories about the birth trauma. That's why we're asking how the babies and the symptoms are showing up in a child. And that's what we're going to understand. So just to reiterate, hey, you know, birth trauma can be caused by a bunch of factors. Position of the baby, complications during pregnancy, even the way the baby's labor and deliver can have some issues. Those birth trauma can affect the upper neck, specifically this vagus nerve. When the nerves are compromised, we call those subluxations in the spine. And if that nerve's not working correctly, different parts of the body associated with that nerve are not going to work correctly either. The job as a pediatric chiropractor is to trace back those symptoms to the source of the nervous system that's not working correctly. Correct those subluxations over a period of time with chiropractic care and allow that body to function the way it's programmed and designed the way it functions. So we don't have baby Addison showing up, or you don't have to have that discussion with the medical doctors, how we're going to save the baby's life. We can say, how can we get your child to thrive through life? Sometimes it does take some course correction. And the miracle of life, when the baby's born, I've been through it. It is such an extraordinary experience when I got to catch my daughter for the first time and know that we're going to do everything that we can to help keep her and her body working the best she can. Not only when she was born, but, you know, she's almost 5 years now, a healthy baby girl. And I just say, hey, she's been adjusted from 2 hours old from day one and has been adjusted at least every week since for 5 years. So, hey, I'm Dr. Randy West. I know this could be a topic that can weigh heavy on your hearts, but please give me a call, because not talking about it doesn't solve the problem. Discussing it, have somebody you can understand your story and what you walk through can help you understand what we need to do and help you as well, and help your child thrive throughout life. Hey, I'm here to help you in any way possible. Give me a chat, send a direct message to the Facebook page. I'd be happy to help you and your child and your family. Hey, take care. Do something memorable today with your family. Get outside and play too in the snow. Take care. Bye-bye.